hospitals abroad are nothing like we expected, but we also didn't expect to have 2 surgeries in 2 different countries. But we wanted to update everybody on what happened and give you kind of the rundown of our experiences of our surgeries in Thailand and Cambodia. So let's start with what happened. What happened, Scott?
Well, what had happened was, we're actually in Don Det, Laos, which is a little island down on the Mekong Delta, and there's no light there after dark. We had bicycles. I was riding home after dark and hit a hole, fell off the bike, was stopped on the tip of my elbow, actually this one, and it snapped the olecranon off of the ulna bone, which we were moving the next day, so didn't have time to deal with it at that point. 4 days later, my watch wouldn't fit over my hand anymore, so I figured it's probably time to go to a doctor. At that point, we were in Siem Reap, Cambodia. What happened to you?
What happened to me? Oh gosh. Mine wasn't as dramatic and quick. Apparently, over the course of maybe 2 years, definitely the last year or so, I've had a pain that's been going down my left leg, and it's made it so it's almost impossible for me to walk. And so I was feeling a burning sensation in my foot, and my knee wouldn't work properly. Like I would walk a little bit and then sit down. It's a miracle that we made it through the 4-day hike of the Inca Trail, but there were a lot of stops there. But I was starting to walk with canes, and the whole thing was just getting really bad. And so we happened to be in Thailand at the time, and the master researcher found a spine place, a really great, amazing spine institute that was in a hospital in Bangkok. So we went there, and turns out that my L5-S1 vertebrae, there's a disc that goes in between your vertebrae that's supposed to give it space. Well, mine was compressed, and not only was it compressed, the alignment on my spine was shifted in a way that my nerve was being pinched. So that was the cause of the pain in my leg, and the only way to resolve that would be through surgery. And so I had the L5-S1 lumbar transfusion surgery, which essentially I had the vertebrae on my spine fused together and then a space put in.
Yeah, and we'll show some x-rays up here. It's nothing too graphic, so I don't think you need to be warned if you're squeamish, but they're just x-rays. Hers obviously are going to be of her spine. It was quite crooked to begin with, and now she's sitting up taller.
Sweet. So that was the actual surgery. What do you talk about kind of your doctor and what your experience was in Siem Reap, Cambodia?
So for mine, I also researched, found what was supposed to be like the best practice, the best orthopedic surgeon that I could find there in Siem Reap. I can't attest to whether he was or not. I just know we had just got done with hers in Bangkok, which is known for medical tourism. So I got to my place. I mean, the doctor was fine, took x-rays, was able to print them out immediately. So it wasn't like in the States where it's go to a general practitioner, they'll send you to an orthopedic surgeon, he'll send you to imaging, and then you go back. It all happened one day. I went in, got x-rays, he looked at them immediately, he could show me, and we'll put them right here where it was definitely broke. There wasn't any way of getting around it, it wasn't going to heal on its own. So basically he gave us an upfront price, said this is what it costs, give me that money, we'll get you fixed, we can do it either today or tomorrow. I mean, as simple as that, honestly.
Yeah, quick and dirty. And I had a similar experience in Thailand where I scheduled an appointment with the doctor on a Sunday evening. I had actually had x-rays from Costa Rica, and so he looked at the x-rays and was like, these are not great x-rays. So that evening I went and had imaging done, and then the next day we came back.
It's worthy to note, this is actually on a Sunday night.
Sunday night, 8 p.m.
One of the top spinal institutes, the top guy, said, yeah, if you can make it here, I'll see you at 8 o'clock on Sunday evening.
Yeah, it was great. And so saw him, I was explaining what I was experiencing. He had me walk up and down. He's like, yep, it's this, but I want to confirm with x-rays. And so we had the x-rays done the next day. I think we met with him maybe at like 10 o'clock on that Monday morning, and he confirmed that, yep, this is what's happening. You're going to need the surgery. And I was very hesitant about having the surgery for a ton of reasons, mainly because my father had a similar experience. I think he had the same issue, and his had several surgeries and none of them were successful. So for me, I did not want to have surgery. And so we talked to him about some alternatives, and the alternative was to get a steroid injection into my spine. And he said that should give me relief so that I can decide what I want to do. I can get back to walking normally, all of that good stuff. So I think we were leaving that night to go back to Pattaya because we were staying in a different town. And he said, I can get you in the next day. We said, oh no, we're leaving today. And he reworked his schedule, and I got the shot that day. It was amazing. So to have like him be on top of it, to be listened to get us adjusted. He was absolutely right. I was absolutely out of pain. But I was out of pain for about a month, and then the pain started coming back, and that's when...
Which he said, a month to 3 months tops. We just want you to be able to move around, and, you know, the better shape you're in, the easier the surgery is going to go. So that was the goal. He didn't make any promises that this is going to last for a year.
No. But I think having that time period where I was not walking with canes, and I forgot how good it felt to be out of pain. I was like, yeah, we're going to have the surgery. So a month went by, we called him back and said, yep, we're ready to schedule the surgery. I want to say between the time we called and the time that we got in to have the surgery was less than a week. So we had to make arrangements to fly back to Bangkok, and other than that, everything was set. They arranged for us to get our visas extended, because with a medical, if you have a medical reason why you need to stay in the country, they have a department that works with medical visas. So we got our medical visas extended at a fee. And the other thing to mention about fees is that I knew exactly how much it was going to cost at every step of the way. When we met with him, all of that pricing was laid out for me. When we talked about the steroid shot, I asked him how much it cost. He gave me a number that I was comfortable with, so we paid that. And then when it came time to the surgery, there was a number, and the number covered everything. It was the anesthesiologist, it was all of the medications, the hospital stay, my food, like everything was laid out. So there was not going to be any surprises 2, 3, 4 months down the road. We're like, whoa, we forgot to charge you this. So that to me was really comforting to know exactly pricing wise what it was going to cost. That was so nice. And that was your experience too, where you knew
same
what
thing.
it was going to cost.
Yeah, they gave me a price, said this is going to be what it is, even for the checkups later on, for future x-rays. The only thing it wouldn't cover is removing the hardware, but I mean, that's kind of expected, because that's 6 months, a year down the road.
Yeah. So that's our diagnoses, and that's what happened when we decided to follow through with the surgery. So let's talk about your surgery, sir.
I think we should start with yours, because that's the...
My surgery experience was phenomenal. The hospital is very organized. It's called Bumrungrad International Hospital, and it's the kind of hospital where they have valet. There's a Starbucks and an Oban pen in the lobby, and it's all inclusive. They have literally everything you need. The imaging is there, the blood work is done there. Like anything that I needed done was all managed within the hospital, even including the physical therapy. So that was nice to have a one-stop shop there. In my package that we approved with the doctor, it included a private room. My private room was really nice, so I had, a room to myself. There was a bed for Scott if he was going to stay the night for that, a giant TV. I had my own
kitchenette.
A kitchenette, my own bathroom. I was comfortable the entire time. The thing too is that everything there in my room was branded. The water bottle was branded with the hospital's name, the towels, my robe, our slippers.
Yeah, I should say our slippers.
Our slippers that we kept. The shampoo, like everything in this place was branded, which was really nice. So yeah, I would say it was kind of a luxury experience. I wasn't even top tier. There was a tier above my tier. I don't even want to know how beautiful those rooms were, but it was immaculate. The nurses were really cute. They were the kind that had the old school white hats. If you look at like a World War II movie and the nurses have those hats, they had those on. Pretty much everybody spoke perfect English, so there wasn't a language barrier there. My doctor spoke perfect English. The nurses on the day shift spoke pretty perfect English. I think the night shift people may not, because
we're working on it.
typically at that point the patients are sleeping, so you wouldn't need to. For my surgery, I was going to have somebody check on me every 2 hours, but even when they did that, it was really kind of, they were patient, they were delicate. Everything in my experience, I was there for 2 nights. And I almost didn't want to leave. It was so nice. My meals were balanced. They didn't have a lot of sugar. They were really delicious. Some of them, I got a menu to choose between whether I wanted Western food or local Thai food. So I switched back and forth on either day, but everything was perfectly balanced. There wasn't sugar. They were able to manage my gluten restrictions. So yeah, I think it was a really great experience. I knew what was happening every moment, every 2 hours. They encouraged me to walk. My doctor came in, I think the day before I was released, just to check on me. He was very encouraging. He said, you know, you're healing way faster than a lot of my patients. I think that's because a lot of patients that have this surgery are older than me. So I think I was recovering really well. So my post...
Well, let's jump into mine.
Oh, yeah. So
we'll do a little back and forth here.
Compare and contrast. What was your hospital experience like?
So, same thing, money up front. We knew what it was going to cost, actually paid up front. I had a VIP room also.
You did?
I got led to my room. The staff did not speak English. The reason this doctor was supposed to be one of the best, rated by expats, was his English. It was very basic, so it was kind of like, you go there. And that was what I got out of my doctor. Nobody else spoke any English, which is fine. That's a me problem, not a them problem. But get to my room. When we get to the hospital, they ask if we have the x-rays. No, why would we have the x-rays? Oh, well, because we put them in a package for you yesterday. So Jen has to jump in a Grab to go back to get the x-rays. I get led up to my room, to the VIP room, get up there, and the guy says, okay, go ahead and disinfect yourself and put on a gown. And I looked around the room. There's literally nothing in there. I look in the bathroom. There's an old soap container from the last person that was there, but no soap in it. No towels. So I asked the guy the best I could. I translated it. And he says, no, you bring.
And by the guy, this is your nurse.
Yeah, the nurse. So Jen is already on her way, but I text her and say, hey, I guess grab towels, grab soap, grab everything you can think of for me to disinfect myself before surgery. And this is, you know, a month after her experience, so I already know this isn't really on the up and up.
One of these things is not like the other.
She got there, cleaned myself off the best I could. I mean, I can't really because I had one arm. She helped me out as much as she could. They brought me a robe that was made for a Cambodian.
It was a little small.
Yeah, it didn't quite fit. We asked for a different one. Finally got one that, you know, at least came to like here when I tried to close it up. So, whatever. So yeah, slightly different. Oh, after surgery, she talked about her care. Literally had nobody. She was there, and that's it. I had a little fuzzy blanket on me when they put my IV in, which when they put my IV in, there was an air bubble about that big heading down to my veins that I had to point out to them. And the lady just starts tapping on it to try to make the bubbles smaller as they're going in my veins. And eventually another nurse came in and he pulled it out, got all the air out. So I'm already thinking, may not be the best idea. But we're here, and I didn't know how long, because it had already been 5 days since it had broke, so I didn't know how long, you know, am I doing more damage by not doing something about it right now immediately. After they put the IV in, the guy just grabs the bag off of the roller and starts walking like I'm a dog. I have to jump out of the bed, hold on to the IV as he drags me to the elevator and brings me into the operating room.
And I think you keep calling him the guy because it didn't didn't
Who
seem
knows
official.
what he was, yeah.
They didn't seem official in terms of nurses or who was doing what and who had what role. They had scrubs, but they would just kind of come in and out. They didn't have name tags or anything, so I think you're calling him the guy because we have no idea who they were.
I hope he was a nurse. Also, she had mentioned blood work. No, they don't even know what blood type I am in case I started bleeding out. That would have been, well, I guess that was on me.
Yeah. Before my surgery, I had blood work. They checked my heart, and just to make sure that I was going to be fit for surgery, that nothing was going to happen in the middle of the surgery, and that was not.
No, and post-op, she mentioned her food. My post-op was have her order food on Grab, and they'll deliver it to you. We don't have anything. Oh, you didn't bring your own water? As far as a nurse call station, didn't exist. There was no monitor on me. They rolled me in after post-surgery, put me on my bed, and we didn't see him for 11 or 12 hours.
Yeah, I think there was no like call button. They give you a phone number.
They gave me a phone number, and I told them I don't have a Cambodian number, so I can't call. Is there a WhatsApp I can call? No, don't worry about it. Okay.
So the experience I had where somebody was checking on me and monitoring my levels of my fluids every 2 hours was not your experience. In fact, I was in the room with you, and the saline drip that was going into your arm, I think at some point I noticed that's getting really low.
Yeah.
They're definitely going to come in now and let you know it's low, but we didn't want to take that risk, so I went downstairs and again with our translator app was like, hey, I took a picture of it and was like, hey, this is low. And they went, oh, okay, and then they came up and changed it. But then we were like, do we need to do this every time? So I think at some point we set an alarm just to check on you every 4 hours, just to check on your levels, make sure you were okay. I mean, I don't know how much sleep you were getting anyway, because your room also did not have a TV.
No, there was nothing in this room.
So.
No monitors, no TVs, no call buttons, nothing.
It was a little different than mine. So, and I slept over just because I felt like you needed an advocate in case you fell asleep, which I don't think you did, but just somebody to keep them on top of things, you know. For me, I had medications that I was getting intravenously, and so things like antibiotics, anti-inflammatory, so I was asking them, like, does he get an anti-inflammatory? Does he get antibiotics? I said, oh, he got that during the surgery, and I was like, well, does he need them more frequently? And they said no. That was a little concerning.
Yeah. And actually, this is, I think, 3 weeks post right now. And if you've ever seen Pulp Fiction, where they take the needle and they slam it down through the lady's chest, that's how I kept getting shots in my leg. 3 weeks later, I can't squat because my leg hurts so bad from the shots that they would give me. Just right in.
Yeah, that was it. And that was not my experience either. It came intravenously.
Yeah, I had an IV.
Yeah.
But they wouldn't, they were like, nope, we'll go right here.
Yeah. So that was the surgery itself. We'll talk about post-op. So you're a little...
Well, that wasn't even the surgery. That was the lead up to it. Like, go for your surgery.
All right, the surgery itself. So I arrived at the hospital 10 p.m. the night before. My surgery was at 5 a.m. the following day, and so I was there overnight. I think they just want to make sure I wasn't eating or drinking anything, that I was fine. I think they woke me up at like 4 just to do the antiseptic shower,
to clean her,
and to do all that stuff. And then I had my robe on, and then they rolled me into, you were there just to give me a kiss, which was really sweet. Then they rolled me on a gurney. I didn't have to walk. They rolled me on a gurney into pre-op, where I think it was the anesthesiologist came in, marked on my spine where the points were going to be, and then where they were going to give me the anesthesia. And then they rolled me into the OR. There were so many people in there, I couldn't even count. And so I think for me, actually, it felt better that I didn't speak Thai, because I have no idea what anybody was saying. So there was a bunch of people running around in scrubs and masks and booties, but I have no idea what anybody was saying until the anesthesiologist came in and asked me to count backwards from 100. And so after that, I woke up in my room. So,
and we'll put a picture up here of what she had.
And the machine.
The machine,
cool.
like there was no guesswork at all. Like they could see everything inside of her through this. She's basically in a tube, bent over it, that they were working on her in.
Yeah.
So,
yeah, so
top of the line.
They had me lay flat on my stomach, and then I think the machine went down like this so that they could work directly on my spine here, but everything was done through imaging and
around it.
And the machine, the stuff was really small. I didn't see it. He showed us a little picture of it, what it looked like. But after the anesthesia shut in, I didn't feel a dang thing. Next thing I knew, I woke up in my room, and Scott was there.
Yeah.
That was mine.
Got let in after I got my IV put in. The nurse, he grabbed the bag. I know now why, because I tried to go to the restroom the next day, and the rollers on the whatever it is that holds the IV bags, the wheels didn't roll. So that's why he just grabbed it off and started walking. And I had to grab it because it's attached to my arm and follow him out the door with this little fuzzy blanket that I was already wearing. And we walked to the elevator, go down, leads me into the OR room, tells me to get on the bed. I look down, I can see cut marks all over the bed. So clearly they weren't that accurate with their razor blade, but we're here now, so I guess obviously if it was anything in this area, I would have just left, but it's the arm. My left arm already doesn't work very good, so let's get it done. I lay down on the operating table, staring up at the lights. I can see dust particles in the air. That's encouraging. There's people coming in and coming out. They're all on their phones. I know where phones go. They're not always in a sanitary place. Eventually, I mean, the doctor actually was in there. He talked to me a little bit, but then they were just kind of talking amongst each other. I don't know what. I really don't know. They were just killing time, waiting for something, because the anesthesiologist was always there too. Eventually, he gives it to me. No countdown. I'm watching a clock. Somebody got in the way of the clock, so I guess somewhere there I went out. And I actually came back to, I think like the second they finished stitching me, because I was awake watching them finish up and wrap me. And then roll me over to her, where they basically turned me over.
They're like, he's your problem now.
Back to you.
Okay, so now let's talk about the actual procedures that we had done, essentially. So, what was yours?
Mine was a TBW, which is tension band wiring. Basically, they put a pin here and a pin on the broken end of it, and then baling twine is what it looks like. I'll put a picture up here. I mean, you can see where they just kind of twisted it together to hold it all together. I have done a fair amount of research since then. I should have done more before, but it seems like that's the way it's done. It's not some janky way that they were just doing it to get me out of there. I'm 3 weeks out right now. The scar actually doesn't look very bad at all. It healed quite nicely. I can move my elbow. I'm not supposed to be doing too much yet. I'm waiting for another week to get x-rays done to see how the bone's healing before I can fully start physical therapy. But basically, yeah, there's 2 pins and wire wrapped around, pulling it all together.
And you have a hell of a scar for where they had to cut you.
Yeah, he did say it was going to be, he showed me on his hands about like that. Well, the scar goes from here to here, so
A little bit bigger.
it's a little bit more like that, but whatevs.
So my procedure was a translobar fusion surgery. So essentially what happened is that, so there's the two vertebrae. So there's a vertebrae here, a vertebrae here, and then in between there's a disc. And so my disc was degenerated. So what they did was they took a piece of bone from my spine and put it in a little plate that's like this. In the center of it is the bone that they took to regenerate. So the goal is that it'll regenerate on its own, but it's got some padding around it to help in the meantime. So the disc is going in between my two vertebrae, and then the vertebrae have, I have 4 platinum pins to hold everything in place while my spine grows back together. So
You're also offset like
yes,
this, so
yes.
pulled it back to make her straight again.
I'm realigned, yes. So the nerve that was being pinched is no longer being pinched, and my spine is back to being realigned. So, and then the pins, the 4 platinum pins that do set off
every time
at the airport, it sets off the metal detector. But so I'll have those for life. Your hardware will get removed, mine won't. So my hardware will stay in forever.
Yeah.
So let's talk about post-op. What does your post-op look like since surgery? What's next?
Well, I went in every 2 days post-op, just so they could, because they didn't cast it. They wanted to be able to change the bandage, take care of it every 2 days, which they did, and then I had to keep fighting them. I don't know if their calendar system doesn't work. They wanted to take the stitches out in like 4 days, and I'm like, hey, no, I'm staying here for another week. Like, at least let me have these stitches for 7 days. I think we got exactly that, 7 days before they pulled the stitches out, and
they came out pretty clean.
Yeah, they came out pretty clean. The scar actually doesn't look near as bad as I thought it was going to look.
No.
And then, yeah, we'll do imaging. We're in Vietnam right now, so we'll do imaging probably in Ho Chi Minh. And then he said, just send me a WhatsApp picture of it. We'll be good. Okay. I'll probably just have the doctors in Ho Chi Minh look at it and see what they think.
So my post-op was, I walked out of the hospital 2 days afterwards. I've got to wear this back brace for the next 3 months, so I call him Dennis because he is in fact a menace. But the goal being, it's just keeping my spine in place while it heals. I can't bend, I can't twist, I can't do high impact activities. So the goal is just to give my back a chance to reattach, but everything else is fine. So I'm back to walking, back at the gym. We're still doing pretty active stuff that avoids those 3 things. And then I go back to see the doctor in 3 months. And so what will happen in the post-op is he'll do a CT scan just to make sure that my spine is healing the way he had hoped. And I think if that's the case, I take this off and then I'm good. I do have to take 1,000 milligrams of calcium for a year, and again, that's just to help fortify my spine and just to make sure that the regrowth is positive. But other than that, I think I have to go back a year after just to check in. But other than that 3-month CT scan and hoping all of that goes well, we had that scheduled before I even left, so I knew what day. We already planned to go back to Bangkok, so that was nice. It's not like it popped up on me out of nowhere. So that's scheduled, and we already know how much that's going to cost, so no surprises there. So yeah, I'm excited. I'm actually looking forward to seeing him again. I want to make my doctor proud to show that he did good work and that I've been able to maintain it.
Yeah, it's super exciting seeing her walk again. We haven't been putting a lot of videos out. Obviously, we've been going through some stuff. I sat down and started doing some videos, but just her on just canes, I'm like, I don't want to. We'll see. Maybe in the future we'll get those out. For now, we have better ones we've done since already, so we'll go with them.
We're looking forward to that. So thank you for joining us on this recap of our experience here. Please note this is our experience and our 2 surgeries with our two doctors. This is not at all a reflection of the medical system in either of these countries. This is simply our experience. This is simply our experience with our specific surgeries, with our specific doctors, with our specific clinics. If you are getting medical procedures done abroad, certainly do your research, certainly do as much. I mean, you're in a different situation where yours is more of an emergency. I had some time to wait, but do as much research as you can. A lot of the hospitals do have websites or at least Facebook pages and ways to communicate, so do your due diligence. Hopefully we found this helpful in terms of what to ask, because obviously we didn't know what to ask before we went in.
Yeah, do I need my own antiseptic? Bacterial soap? Why would I know this?
Why did you know? But hopefully this gives you some insight on what to ask if you are in either of our situations where you're getting medical procedures abroad.
But I think in general, like, we were actually going to go to Laos 5 days after her surgery, because the doctor said, hey, you're going to be better than you've ever been. As soon as you're done, you're going to walk out of here, you're going to be strong. Cool. We'll leave. And then when we told him, no, you're not going to go to Laos. That's not happening. So, what she says is true. If you have the option, don't plan for medical tourism to Laos or Cambodia. I think here, Vietnam is pretty good. Thailand is like the cream of the crop.
Yeah.
So.
But that's our experience.
Yeah.
So thank you for joining us today. If you enjoyed or you found this information helpful, be sure to like and subscribe.
Yeah, and go ahead and leave us a comment if you've had any experiences with surgeries abroad.
Thank you for watching, and remember, we're taking the scenic route one country at a time, so come get lost with us.
See you on the next one.
Bye.
Hopefully not in the hospital.